Hey, Dr. Steve Ranicki with Dr. Ranicki's Creating Wellness Center in Savannah, Georgia. So, in a previous video, I talked about the possibility of going to chiropractic college and becoming a chiropractor, and I want to touch a little bit more on that process. Personally, I made the decision that I wanted to be a chiropractor very, very young. I was only 12 years old when I made that decision that I was going to be a chiropractor because it completely, totally revolutionized my health and my life at a very young age. I knew where I was going to go to chiropractic college by the time I was 14. However, I really didn't know enough about how to pick a chiropractic college, and I just picked a chiropractic college based on where my chiropractor went to school, and that may not have been the best way of doing that. I'll get into how you pick a chiropractic college in just a little bit, but first, let's talk about what it takes to go to chiropractic school and to become a chiropractor. I guess to begin with, the first question is, do you need to be a really, really good student to go to chiropractic? And I don't know that you necessarily need to be a really good student. You do need to be smart, but there are plenty of people I've seen, people who have been all types of doctors and not just especially smart, but they're just good students and they were able to do well on a test. But when it comes to thinking about why they're doing what they're doing, all they can tell you is that this is what they were taught to do, but they don't really understand the why. And then you can say the same, of course, about pretty much every profession, I'm sure. But I think in medicine, there's much, much more emphasis put on high test scores, the medical college admission test or the MCAT, and doing exceptionally well in your GPA rather than being a particularly good thinker or problem solver. In chiropractic, it's very different. We focus a lot more on problem solving rather than just remembering all these things that we were taught once upon a time. So if you're not the best student, but you are a good critical thinker and you can understand why things work the way that they do, then you may find chiropractic college to be a good fit for you. To get into chiropractic college, you need to have about 3 years of undergraduate. It's a smart move to go ahead and get the 4 years, but as far as what they actually require to get into chiropractic college, they require about 3 years worth of prerequisites. Now the truth is that's not really any different than for medical schools, dental schools, and so on. I don't think you're going to get into medical college with only 3 years, but they only require 3 years. There's just so much competition for trying to get into medical school that if you don't have the 4 years, you're probably not going to have much chance of getting in. So in chiropractic, unfortunately at the moment, there's not the level of competition for getting into school that there is in medical colleges and dental colleges. So the 3 years is what's required, and that will typically get you in, but certain states do require the 4th year of undergrad. So you can, of course, look at the websites of most of the chiropractic colleges and they'll tell you exactly what requirements they have as far as which prereqs you need to have, but it's usually about 90 credit hours of prereqs. Of course, a good bit of that needs to be in the basic sciences of biology and chemistry and physics, but not most of it. Most of it is actually going to go into humanities, because remember, we are dealing with people, and the better you understand people, the better you're going to be able to relate to them and to do at taking care of them. I would personally recommend a major in psychology if you're thinking about going to chiropractic college. Then obviously it's just simply an issue of applying to chiropractic colleges and giving them your transcripts, and that will very often do the trick for you as long as your transcripts are not horrible. But why become a chiropractor? I can't tell you how rewarding of a career this has been. You feel like you're really doing something that makes a difference in people's lives. Your patients will love you. You typically develop very strong bonds and relationships with the patients you're taking care of. It is a financial rewarding career as well. I suppose if you're looking just for a way that you can make lots and lots of money, I think I could probably do at least as well, if not better, in real estate, or perhaps if I had the head for it, investing in the stock market or something like that. But certainly, this is a career that will give you a very good return on your investment, and you should be able to have a very comfortable lifestyle, as well as feeling like you're doing something really valuable and really important. That's not to say that it's a guaranteed easy income. I've met plenty of chiropractors that are struggling and that I think are really more of a function of how good they are at what they do rather than an issue of how the profession rewards you. And then chiropractic is consistently ranked extremely high in all the different ranking systems as far as how healthy of a career it is to be in and how rewarding of a career it is. Every time there's some top 10 list of whatever careers, chiropractic ranks very high in that, if not at the very top. It's obviously a profession that puts a lot of attention on health and healthy lifestyle, so that translates into being a healthier person yourself and having a longer lifespan and less sickness and less disease. Now, as far as picking a chiropractic college, there's 2 criteria that most people use to pick their chiropractic colleges, and that is either which one their chiropractor went to, or what's the one that's closest to where they live, and neither one of those are actually particularly good criteria, and I wouldn't recommend that you look at those. Instead, I would look at more of the success of the chiropractors that come out of their schools. There are some schools that are very, very good at producing students that will pass the board exams, but when it comes to being actually successful in practice, they're not so very good at that. There's a bit of an issue in the chiropractic profession, most commonly referred to as the straights versus mixers. And very simply what that means is that there are some chiropractors and chiropractic colleges that want to push the profession closer and closer to becoming more like medical doctors. They want to be able to prescribe drugs and things like that. Remember, the real purpose of chiropractic is to give the people the ability to heal and repair themselves without going in the direction of medicine. And when we start to bring drugs into the profession, that actually makes that a lot harder to accomplish our goal. So the straight chiropractors are the ones that want to keep chiropractic very pure, keep its core principles in place, stay away from things like medicine and physical therapy, which is not because those things are bad, but there's already a medical profession, there's already a physical therapy profession, and if those are the things that you want to do, then obviously you can go to medical school or osteopathic school or become a physical therapist, and you'll be able to do those things. But it should be chiropractors doing chiropractic, medical doctors doing medicine, physical therapists doing physical therapy. The colleges that are leaning more towards the straight end of the spectrum are going to be Sherman College of Chiropractic in South Carolina, Life University in Atlanta, Georgia, Life West in San Francisco, and then Parker College in Dallas, Texas. Those are the ones that lean more towards the straight end of the spectrum. But they're on the opposite end of the spectrum will be the far mixer end, where you don't really get a very good chiropractic education. The graduates of those schools typically are not terribly successful because mostly what they're being taught is how to recognize when they should refer to a medical doctor. The schools that lean heaviest in that direction are going to be Western States Chiropractic College, although I think they recently renamed themselves to Western States University of something, Allied Sciences maybe, National University in Chicago, Illinois, Lombard specifically, and then what used to be referred to as Los Angeles Chiropractic College, and it's still Los Angeles Applied Health Sciences or something to that effect there. They've changed their names a couple times. Those lean heaviest in that direction, and there's lots of other schools that are somewhere in the middle. The ones that I would steer you away from the very, very most are the ones where they're not chiropractic colleges, but they're more like universities with all kinds of different degrees, and they offer all kinds of different things, and chiropractic just happens to be one of the many things. And the reason I would steer you away from that is that people teaching there really don't typically have a very good understanding of the nuances of the chiropractic profession and how those things work. I interviewed a graduate of one of those schools for a position in my office, and her ability was much, much less than that I've seen from people who have graduated from chiropractic schools that have always and only been chiropractic schools. And her understandings of the principles of chiropractic and why it works and how it works weren't nearly as good as well. She may have had just a good understanding of the anatomy and physiology, but as far as the part that matters the most in practice, I just didn't see the same ability there. So I would suggest go to one that has always been a chiropractic school, and that's their primary thing, not just some additional thing they happen to offer. But I would certainly encourage you, if you're thinking at all being a chiropractor, take a look further at it. It's an amazing career, and I plan on being in it for a good while left. So again, Dr. Ranicki with Dr. Ranicki's Creating Wellness Center in Savannah, Georgia. Thanks for your attention. If there's anything we can do to help, please let us know.